Hello everyone, my name is Xavier Guerra. I am a second year physician student at South University West Palm Beach, and today we are going to be talking about my community outreach project on reducing COPD related morbidity and mortality in Florida. So first things first, let me talk a little bit about me. I was born and raised in Miami, Florida, not too far away from where I study now. Some of my hobbies include, I'm a passionate sports fan. I love to play a lot of sports, including basketball, football, soccer. And usually during my off time, when I'm not studying or I'm not going to my clinical rotations, I love to play video games. It's something that I've picked up and I love a lot. During my undergraduate career, I studied at Florida International University, otherwise known as FIU in Miami. And I majored in biology with a minor in chemistry. And if you're interested in the medical field, I mean, those are two good majors to really look at. What I did before PA school, so I worked as a pharmacy technician at Walgreens. I worked there for 2 years during undergrad. And once I graduated in 2019, I found a job as a medical assistant in a primary care office, internal medicine. That was a lot of fun as well. Some specialties I'm most interested in today are orthopedics, the ER, cardiology, primary care. But there's so many more specialties that, I really haven't, I need to look into that I think are pretty interesting as well. So I know many of you are in high school right now and are asking me, what is a PA? Is that a doctor? Is that like a nurse? What is that? So PA is a physician assistant, or now known as physician associate. Basically what we do is we diagnose and treat patients a lot like doctors do. We work in all types of specialties across the United States and other countries as well. There's not really a specialty that we go into. We kind of are trained in pretty much everything, and a lot of the things that we learn are on the job as well. We work in a team with collaborating physicians, nurses, other medical staff, basically to make sure that patients are our priority. We work efficiently and effectively to make sure that their care is the number one thing we're concerned with. A lot of you are in high school right now, and I know they're probably thinking about undergraduate or college per se, and are asking me, how do I even become a PA? So first thing you have to do is you have to graduate from high school. Then you graduate with your bachelor's degree. So it's a 4-year degree. Typically you fulfill some prerequisites that many schools are asking for, like your biologies, your chemistries, your anatomy and physiologies, things like that, to kind of fulfill your prerequisites to apply for a PA school. You're also recommended to attain some form of clinical experience, whether it's becoming a medical assistant or a pharmacy technician like I was. A lot of my colleagues are EMTs, emergency medical technicians. They probably were certified nurse assistants, phlebotomists, you name it. Just anything you can do to really get get some form of experience in the medical community. Anything like that would be great. And most importantly is just to have a passion for medicine. It's refreshing to see someone so enthusiastic about our field. And I think the most important thing a patient is looking for is that you are really enthusiastic and passionate about their health and well-being. I also have here a kind of like an explanation to your right of what a physician assistant is and does. We're very involved in ordering and interpreting tests, imaging, x-rays, labs, EKGs, you name it. We help a lot in surgeries. We do preoperative care, postoperative care. We also, like I said, we diagnose. We do a lot of procedures, like we can suture up a a cut. We can prescribe medications. We can recommend different types of treatments like therapies and things like that. And just there at the bottom, you can actually see some other specialties we're involved in. And it's not just limited to those. I mean, there's just so many specialties that you can go into in the field of medicine. If it's something that you're thinking about, you're passionate about medicine, you want to join the medical field, really consider becoming a PA, because I mean, we do a lot of everything, and we're proud of that. So before we get started, if you guys can just do me a huge favor and complete my pre-quiz survey. Just basically, we use this as a way to gauge how much you guys have learned throughout the presentation. So again, if you guys can just do me a favor and click on the link below and complete the survey before we continue on with this presentation. So if you guys have filled out my pre-quiz survey, I do have to put out a quick disclaimer. The information given in this presentation is provided by peer-reviewed and non-reviewed sources. None of this information is my own, and all rights are reserved to the publishers of this information. Content and opinions from this presentation does not necessarily reflect the views of my educational institute. South University does not assume any responsibility for the content of this presentation. None of the information provided is medical advice. Please seek a provider should you need one. So today we are going to provide objective and factual information related to recreational inhalants, what they are composed of, and subsequent consequences that arise from their use. We're also going to discuss about the most common condition that comes from smoking, chronic obstructive pulmonary disease, also known as COPD, and ways to prevent morbidity and mortality. So you might be asking me, what is morbidity and mortality? So morbidity is the number of individuals with the disease in a population. So we're basically counting the amount of people with COPD in, let's say, the state of Florida. We're also talking about mortality, which is the number of deaths from a certain disease within a population. So the number of people that die from COPD in the state of Florida. And my goal is to talk about ways that we can reduce both the number of individuals with a certain disease, like COPD, and the amount of people that die from COPD as well. So we were to pick from certain topics from Healthy People 2030, and basically what they do is they are a set of objectives that were put in place to eliminate health disparities and push for health literacy over the next decade. Health literacy is very important nowadays because there's a lot of misinformation going around, and it's my job as a future provider to provide you with as much information about your well-being and what is going around the world with respect to the medical field and healthcare as I can. And we do that by promoting health and well-being across all life stages, whether you're 10 years old, 18 years old, 30 years old, 60, 80, it does not matter. We're here to promote your health and well-being using social determinants of health. Social determinants of health are the conditions and the environments where people are born, live, learn, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Basically, they are composed of 5 domains, as you can see it right over here. They include economic stability, education access, quality of healthcare access and quality, neighborhood and built environment, and social and community context. These are all very important pillars to the social determinants of health, because a lot of people are either they don't have the means to provide their own health care. They don't have the means to get a great education. They don't have the ability to have the access to health care or even good clinics and hospitals. They don't live in the best neighborhoods. They don't live in the best environments per se. And also they don't have probably the support and the community to, help them not only learn about health, but stay healthy. So how does this all relate to my topic, COPD, in the state of Florida? Well, 37 people with COPD per 100,000 adults aged 45 years and over died in the state of Florida in 2018. 8.6% of Floridians over the age of 45 have COPD in 2020, And 14.6% of Floridians over the age of 65 have COPD versus only about 13% nationwide. So as you can see here on the side, I have a little chart basically describing the percentage of adults who reported being told by a provider that they had COPD. And as you can see, over the past 5 or 6 years, we have basically over 7% to just over 8%. We're kind of hovering over that mark. And this is very concerning given that not everyone goes and sees a provider. So you could figure that that number should be a little bit more than just 7 or 8% of Floridians that have COPD. So before we get any further, I think it's important to understand kind of the anatomy of your respiratory tract, you know, how you breathe, where air travels to, how do your lungs work, and what does COPD really do to your lungs? So first things first, you have air traveling through your mouth or your nose. They kind of connect through a little passageway. It's called the pharynx. It's basically a windpipe that goes down through your throat, and then you have your larynx, or otherwise known as your voice box, that kind of provides, you know, that expels that that air in the form of vibrations, and that gives you your voice. Once you get past that, you get down to your trachea, which again is otherwise known as your windpipe. Whenever you kind of like you drink water and it goes down the wrong way, usually it gets down to the trachea, and that's what produces kind of like a coughing sensation. After you get through the trachea, then your kind of your windpipe splits into two, as you can see here, and they go to each lung. So then you have basically your main bronchus, which is your right windpipe of your lung. Then you have your left bronchus, and then it kind of just disperses into little kind of cavities within your lungs. And this is where all your oxygen goes to, and it gets transferred into the rest of your body from there. And not only that, but that's where kind of your carbon dioxide, which is basically the waste from your body in the form of air, kind of gets expelled into these passageways, and that's how you breathe it out. It goes right back out. So kind of neat stuff that we have here. I'm just going to go ahead and move on to the next slide, and that's where we kind of get into the disease that is COPD and how it affects every single component that we just went over. So you've heard me throw COPD left and right without really giving you an explanation as to what it is. COPD is basically a disease that reduces airflow from the lungs. There are two forms of COPD, chronic bronchitis and emphysema. We'll get into both those types in the next slide, but first I wanted to focus more on this illustration to our left. Basically what it is telling us what a healthy lung looks like versus a lung with COPD. Gives you kind of a better idea as to what we're talking about here. As you can see on the healthy lung side, we have these, remember the bronchus and the bronchial tubes. They're nice and clean. Your windpipe is free of inflammation. There's no, buildup of any mucus per se. Then you have these alveoli, also known as like air sacs. They basically do is they expand and collapse with every breath you take, and they're in charge of something called gas exchange. So oxygen comes down through your windpipe, goes to these alveoli. These alveoli send it to the rest of your body, and in return, it takes this carbon dioxide, the waste from your body, brings it up and takes it back through your windpipe, and you breathe it out. That's what you kind of exhale. That is basically carbon dioxide. So this, like I said, this oxygen moves through the air sac, goes into your blood, and then your blood takes care of taking it to the rest of your organs and keeping them healthy. And then carbon dioxide which is in your bloodstream, travels through your heart, goes into your lungs, goes into these alveoli sacs, and then it's exhaled again through your windpipe. So in a lung with COPD, that alveoli, those air sacs, they lose this elasticity, this ability to make it expand and collapse. So it kind of makes them kind of like rigid, and makes it hard to exhale that carbon dioxide that we really need to get out. Air gets essentially trapped in your lungs, and all those bronchial tubes become very inflamed and narrow. So sometimes you've heard some people, they kind of, when they breathe out, it makes like a little noise, and that's basically what's going on. Their windpipe, their airways are so swollen and full of mucus, they can't really exhale that carbon dioxide that we're supposed to let out. And then sometimes you'll have people with a thick mucus. And all that does is basically causes you to have a chronic cough. And it may have mucus, they may not. It might be a dry cough, but nevertheless, that those are basically some symptoms that they have. And that is a cause for concern. So for a lot of medical students and PA students, we really love these diagrams and illustrations from MedComic. So I'm going to break it down just a little bit for you and kind of give you a summary as to what chronic bronchitis is and what emphysema is. So chronic bronchitis are typically those that have that daily productive cough. They're overweight. They may become blue because they're not able to breathe in and out enough air. So they get a little blue. You might hear them kind of wheeze, or that little weird noise that I was kind of talking about when they breathe out. So those are kind of like your chronic bronchitis patients versus your emphysema patients. They're older, they're thin, they might be frail. You might know a relative or a loved one that may have these symptoms, and more likely than not, they have emphysema. They have a lot of shortness of breath. It's really hard for them to exercise or do anything strenuous because they don't have the ability to breathe it in and out like I had explained to you before. So they get out of wind really quickly. Those are kind of the two distinct differences between chronic bronchitis and emphysema. So now that we know what is COPD, we got to know what causes it. How can I avoid getting this? Well, unfortunately, there are a lot of non-preventable factors that cause COPD. Sometimes if you live in a place where it has a lot of pollution, you have asthma, you had some type of chemical exposure. Usually as you get older, you have a higher risk of developing COPD. And not to mention if you have this thing called AAT deficiency, also known as alpha-1 antitrypsin. Basically, this is a protein that is created in the liver, and it basically just protects your lung, gives it that extra layer of protection against, various inhalants and dangerous substances that you breathe day to day. If you don't have that protein, usually that makes exposure to all these harmful inhalants that much more destructive to your lungs. So therefore, you're much more likely to develop COPD. But what I want to talk about today is the number one most preventable cause of COPD and the biggest risk factor for getting COPD, and that is smoking. So you might be telling yourself, hey, why is this guy telling me about COPD if, I'm healthy, I'm young, this is like an old people disease? Well, with smoking being the biggest risk factor for getting this disease, I believe that it is important to start young and not be exposed to these harmful inhalants, and this can decrease your chance of getting COPD later on. So let's talk about smoking cigarettes. Smoking accounts for as many as 80% of COPD-related deaths. 80%. That's an astonishing number. 38% of nearly 16 million people with COPD report having smoked in their lifetime. And secondhand smoke exposure can slow lung growth and development of and increase the likelihood of developing COPD in adulthood. Meaning, if you are in a house that your parents smoke, your grandparents smoke, you're around a lot of friends that smoke, that itself increases your chance of getting it. So it's not just harmful to you, it's harmful to the people around you. So this illustration basically shows what a healthy lung looks like versus a smoker lung. As you can see, the healthy lung is pink in color, it's normal in size, there's no inflammation in the airways, and there's a muscle that helps kind of like help you breathe in and out called the diaphragm. And as you can see on this side, it's nice and dome shaped, as opposed to the smoker lung, which is gray and black, hyperinflated, which means like it's overinflated and really rigid. There's patches of inflammation and swelling, so it makes it harder for you to breathe. And the muscle that I was talking about, the diaphragm, basically it lost in muscle tone, so it's really hard as it is to even kind of like take a deep breath and in and out. So those are kind of like the little things that cigarettes kind of do to your lungs. And I'm going to go ahead and put in a quick video which kind of shows you a little bit better as to what a smoker lung looks like.
Take a look at these two sets of lungs. This set is pink and healthy. They represent the lungs of a healthy person. But this set doesn't look so great. They represent the lungs of someone who has smoked a pack of cigarettes, that's 20 cigarettes, every day for 20 years. Let's take a closer look at what's happening in the healthy lungs. They're being inflated with air, just like when we breathe. As they fill up with air, both lungs expand like they should and push oxygen into your bloodstream. We need oxygen for our body to work. When we breathe, air passes through our nose or mouth into our trachea or windpipe. In the trachea, air passes cilia. Those are tiny hairs that keep dirt and mucus out of the lungs. From the trachea, air passes into two large tubes. Each tube splits off into many smaller tubes. At the end of these smaller tubes is a cluster of tiny air sacs. There are over 600 million air sacs in our lungs. Imagine how small they must be. Each air sac is covered in small blood vessels that take the blood directly to your heart. The oxygenated blood goes directly to your heart, and your heart pumps it to all the cells in your body. Now, back to the smoker's lungs. These represent the lungs of someone who smoked for 20 years. These lungs are a blackish brown color because of the tar that comes from each cigarette. Tar is a sticky black substance that is created when some chemicals burn and melt together. The tar created by burning tobacco is similar to the tar that is used on roads. Tar in your lungs may lead to lung problems that can make it hard to breathe. Even though vaping doesn't force tar into your lungs, it does cause your lungs to get inflamed and clogged with blood, pus, and other fluids. The chemicals in cigarettes also cause lung cancer. If you look here, lung cancers have started to form. They start in the cells that line the surface of the lungs, like this white area. The lower portion of this lung doesn't inflate. That is what lung diseases like COPD and emphysema look like. People with these diseases find it hard to breathe, and they struggle with even the smallest, easiest activities like walking. Which set of lungs would you like working for you? The choice seems pretty clear.
So now that we've talked about the substance that everyone recognizes as being very dangerous in cigarettes, I wanted to talk about e-cigarettes, also known as vapes, pens, and other names as well. So they were initially created as a substitute for adults that smoke cigarettes. They were really never intended for teenagers, young adults, and non-smokers, despite its popularity now in the younger population. A product that really has little to no research, and a lot of it is being done as we speak, to determine the efficacy in helping stop those that smoke cigarettes per se. They really contain a lot of nicotine and harmful substances that cause long-term effects, especially since it's such a easy thing to pick up, easy to buy, can be smoked as much as you can. It's really a harmful substance that we are going to talk about today. So in a study done by the American Journal of Preventive Medicine with over 700,000 participants, those that smoked e-cigarettes reported 11% had COPD. Nicotine coats your respiratory tract, like we talked about, which causes the same effects as cigarettes over time. There's a substance called diacetyl, which is that buttery flavoring that is in many e-cigarettes, kind of gives it that bubblegum flavor or berry flavor. There's so many flavors nowadays, and the reason why you get that flavoring is because of this substance called diacetyl. And the problem with this substance is that it causes a lot of inflammation and symptoms that are similar to COPD. In other words, there's really little to no difference between cigarettes and vaping when it comes to COPD. So this chart by the National Institute of Health illustrates vape use in 2017 by basically teenagers itself. So here it's kind of split between 8th graders, 10th graders, and 12th graders. As you can see, in the past year, back in 2017, 17.6% of 8th graders had vaped. 32.3% of 10th graders used a vaping device, and 37.3% of 12th graders use a vaping device. And that is concerning because really, what are they vaping? As you can see on the right, you can determine, whether they've vaped nicotine, marijuana, or just for flavoring. And like I said, nicotine and flavoring are very impactful towards your lungs. It really deteriorates them over time. And so does cannabis, because at the end of the day, it's a foreign substance that doesn't belong in your lungs. And at the bottom, you can see nearly 2 in 5 students in 12th grade report past year vaping. Really, it raises concerns not only about lungs, but your brain health and potential for future addiction, which obviously we are trying to avoid. We have another nice chart here from the CDC that also illustrates vape use throughout the years in high school. So as you can see, in 2014, only about 13.4% of high school kids used the vape, as opposed to when they determined that this became an epidemic, like in 2019, at the height of this epidemic thus far, 27.5% of high school kids used a vape device. And at the bottom, you can kind of see it's color-coded to illustrate basically if they used any current vaping, everyday vaping, and just like casual and frequent vaping. The frequency also does matter. Obviously, the more you vape, the more exposure to nicotine your lungs get, and the more long-term effects they will have. But nevertheless, any type of exposure can be put you at risk of having COPD. So now we have a really fun activity, basically helping you guys relate to those that have really severe symptoms of COPD. Like I said before, people with COPD experience inflammation in the respiratory tract, making it difficult to maintain enough energy and lung function to perform any activities. Kind of like that old guy I was talking about earlier that can't even climb a set of stairs or walk a block because they're just so winded. Many compare these symptoms to, like I said, breathing through a straw. So in this activity, go ahead and just pause the video, grab a straw, and breathe solely through your mouth using the straw. Do not breathe through your nose. And try to breathe as long as you can and see how it goes. If you feel uncomfortable at any point during this activity, please stop immediately. So once you grab your straw, go ahead and just put it in your mouth. I want you to do that as long as you can, and let me know how it goes in the survey. So we've gone over what is COPD, how can we get it, what are the symptoms like, and how does it feel? Now we're going to talk about how do we treat COPD. So there's a combination of various things that we do as providers to treat COPD if you do have it. First things first is, we gotta stop the source, which is stopping all smoking. As soon as we stop smoking, we can start feeling better, and our symptoms shouldn't deteriorate or get worse. We, of course, have to stay up to date on all important vaccinations, whether that is COVID, pneumonia, flu, really like respiratory illnesses that can really make our lungs work even less than they usually do. Remember, people with COPD are immunocompromised. Their lung function is really low. So it'd really be catastrophic to allow them to develop things like the flu and COVID. We use these kind of inhalers. I'm sure you've seen them, called bronchodilators. Bronchodilator basically just means to open up the bronchus. Remember, we talked about the airway. So we kind of just take a puff of the inhaler, and that kind of opens up the airway and allows people with COPD to breathe better. There are sort of combination therapies with different inhalers that many providers prescribe if need be. And also we can use some anti-inflammatory medications such as like steroids. Steroids basically just help maintain the airway kind of open for a short period of time in case there's like a really bad episode of COPD. In the case of really severe symptoms of COPD, where a lot of patients are deprived of oxygen, providers will prescribe them oxygen therapy. I'm sure you've seen this before. They're little machines kind of this big. They kind of hang around the shoulder, as you can see with this gentleman in the diagram. And they basically, it just gives them oxygen. And they transport it to the little tube, and they have that on all day. it can be very uncomfortable because first you got to carry that thing, and then for an older person, it's heavy, it's uncomfortable, it makes a certain noise, so it's uncomfortable for everyone around them. So it's a really just not a pleasant thing to go through. The oxygen can definitely help them breathe better. It improves their physical activity, so they're able to, potentially climb a set of stairs or walk a block. They can sleep better. They really can lower their chance of dying. As you can see here, the oxygen of a patient with COPD is typically lower. The oxygen level itself is lower than a patient that does not have COPD. So it's important for them to have an oxygen machine that gives them that extra boost of oxygen so that they can breathe better and feel better. Obviously, this is a very severe case of COPD. The best thing to do is, to not get to this point, not smoke, not even vape either. So if you do smoke, or vape, no need to panic. It's never too late to quit. The moment you put down the cigarette or vape pen, that quickly reduces your chances of further lung damage. And it reduces your chances of developing COPD in turn. There are various nicotine replacement therapies like patches and lozenges that kind of help with any nicotine cravings you may develop when you stop smoking. The best way to reduce the chance of developing COPD, of course, is to never start smoking. If you've never smoked in your life, maybe it's a good thing to not even tend to that curiosity of wanting to try to smoke. It's just not worth it. As you can see in this presentation, there are so many repercussions when it comes to smoking, whether it's vape pens or cigarettes themselves. And it's best just not to get into a situation where you develop COPD or you see a loved one develop COPD. It can be really sad, and like I said, the best thing is not to start. And these are my references for the presentation. And I just want to thank you all for watching this presentation. If the chance, please complete the post-presentation survey in the description box below. Really, this is what I use to gauge how much you have learned throughout this presentation, and it's important for me and my school to get that information. So again, thank you very much. Hope you have a great day, and again, please don't smoke.